Hello everyone, my name is Sumara and I'm a final year pharmacy student from University Brunei Darussalam. In this video, we will be talking about the role of folic acid in preventing birth defects during pregnancy. But first thing first, let's talk about neural tube defects. The neural tube is responsible for the formation of the baby's brain and spine. Neural tube defects are serious birth defects and are a significant cause of infant death and lifelong disability worldwide. The two most common neural tube defects are spina bifida and anencephaly. In spina bifida, the neural tube fails to close at the bottom. As a result, the parts of the spine that enclose and protect the lower spinal cord do not completely form, allowing the cord to protrude or stick out. Children with this defect often require surgery and have permanent disabilities including leg paralysis and developmental delays. On the other hand, in the condition called anencephaly, the neural tube fails to close at the top, preventing large parts of the brain and skull from developing completely. Babies with this defect are unable to live and usually die before birth or soon after. The exact cause of neural tube defects is not clear, but may be related to hereditary, environmental factors, or maternal nutrition, including folic acid deficiency during pregnancy. Globally, more than 300,000 babies are born with neural tube defects every year. In 2017, about 20% of deaths for the population below 19 years old in Brunei Darussalam were caused by congenital disabilities or birth defects. Can neural tube defects be prevented? Yes, neural tube defects can be prevented. Several research studies concluded that folic acid supplementation in a multivitamin regimen could prevent neural tube defects by 50 to 70%. Major birth defects of the baby's brain or spine occur very early in pregnancy, 3 to 4 weeks after conception, when many women may not even be aware that they are pregnant. Because the neural tube develops so early in pregnancy, experts recommend that all women who can become pregnant take 400 micrograms of folic acid every day, starting at least 3 months before pregnancy until week 12 of the pregnancy to help prevent neural tube defects. You can take folic acid with or without food. If you forget to take the folic acid supplement, take it as soon as you remember, but skip the missed dose if it is almost time for your next dose. Do not take 2 doses at one time to make up for the forgotten dose. To help you remember to take your medications, try to take them at the same time every day. Folic acid 400 micrograms is available over the counter. For example, in The Guardian. Some examples of folic acid supplements that can be found over the counter are Nature Med Folic Acid, Value Pack Folic Acid, and Appeton Essentials Folic Acid. However, if there is a higher risk of neural tube defects during your pregnancy, your doctor will recommend a higher dose of 5 milligrams. This strength of folic acid tablet is not available to buy and needs to be prescribed by a doctor. What is folic acid? Folic acid is a human-made form of folate, which is vitamin B9. Folic acid is converted into folate in the body. Folate can also be obtained naturally from several foods such as spinach, broccoli, avocado, and peanuts. You may think, if you can get folate naturally through foods, then why is it important to take folic acid supplements during pregnancy? There is no guarantee that you will get the recommended amount of folate for a healthy pregnancy from food alone, which is why it is important to take a folic acid supplement in addition to eating foods rich in folates. Generally, your body needs folic acid to help make new cells, including brain cells, blood cells, DNA and RNA, which are the hereditary material inside your cells. You need even more folic acid during pregnancy because your baby's body needs it too. Folic acid helps your baby's brain and spinal cord develop normally, thus preventing neural tube defects. Are there any side effects of folic acid? Well, because folate is a water-soluble vitamin, any excess folic acid in the body will be quickly excreted in the urine and will rarely accumulate to toxic levels. Therefore, it is rare to get side effects with folic acid, but some people may feel nauseous, lose appetite, or feel bloated. These side effects are usually mild and do not last long. However, suppose you experience a serious allergic reaction, for example, wheezing, feeling a tightness in the chest or throat, trouble breathing or talking, swelling of the mouth, face, lips, tongue or throat. In that case, you should seek immediate medical treatment in the hospital. Last but not least, storage. The medicine should be kept out of reach from children and stored at room temperature in a cool, dry place. We have almost come to the end of the video. Before that, I have prepared 3 true or false questions related to what has been covered in the video. You may pause at every question and answer it yourself first to test your knowledge. Statement 1. Major birth defects of the baby's brain or spine occur at the end of the pregnancy. True or false? False. Major birth defects of the baby's brain or spine occur very early in pregnancy, 3 to 4 weeks after conception, when many women may not even be aware that they are pregnant. Statement 2. It is important to take 400 micrograms of folic acid every day, starting at least 3 months before pregnancy until week 12 to help prevent neural tube defects. True or false? True. In addition to eating foods rich in folates, it is also important to take 400 micrograms of folic acid daily, starting at least 3 months before pregnancy until week 12 to ensure the mother and baby obtain enough folates to help prevent neural tube defects. Statement 3. If you forget to take folic acid supplements, take a double dose to make up for a forgotten dose. True or false? False. If you forget to take the folic acid supplement, take it as soon as you remember. But skip the missed dose if it is almost time for your next dose. Do not take 2 doses at one time to make up for the forgotten dose. And that is all from me. I hope this video can enhance your knowledge of how folic acid can help prevent neural tube defects during pregnancy. Thank you for watching.